I read a recent article in a medical news feed called Stat entitled "I Trust My Drug Dealer More Than I Trust This Vaccine," referring to a COVID vaccine. The article was mainly about the stigma in the health service that people with addictions face, but I think it highlighted some important points about being accessible, listened to, respected, and treated in a humane manner. What's your opinion on the important points highlighted in the article? Could healthcare professionals have adopted some or all of these principles in vaccine delivery to the hesitant?
Yeah, that's, I think this is the difference in the model between what we did in Canada and, for example, what they did in the UK. So in Canada, we had basically a public health rollout of these vaccines. People lined up, went through, one after the other, and it was sort of a process. Whereas in the UK, they got their family doctors involved in the rollout, which did not occur here. And I think there's more of an opportunity when somebody is vaccine hesitant to speak to their physician and have that conversation about their concerns. And so consequently, the uptake in the UK was quite high. It was about 90% compared to, here at most 85% in Canada, and even lower in the States. So I think the approach of using the family doctors in the rollout was an important factor in the high uptake in the UK. I actually volunteered to work in some of these, public health mass vaccination projects. And my job was to greet people as they came in and, sort of just direct them where to go and sit down. And this one guy came in and he was, a big, like, tall guy, very muscular. And he was expressing some concern about being vaccinated. And I unfortunately thought he was kidding. And I, sort of made a joke about it, but then realized that no, he was really serious. He was really afraid. And he, was saying all his friends are telling him he's got to do this for the sake of his community, that, by getting vaccinated, you're going to prevent the spread of the disease. And so he wanted to do it, because he had a good heart. He wanted to do it for the sake of other people, but he was clearly deathly afraid of getting vaccinated. And, he actually fainted at one point and he had to have his head between his knees. So, he wasn't being facetious, unfortunately, like I was. He was really serious about his fear of having the vaccine. So I think in a situation like that, it would have been really great for him to have gone to see his family doctor and have the family doctor explain to him and taking him seriously about what his concerns were, and explain to him, that there wasn't going to be any problem. So, or that is, in a doctor way of doing it. I'm not a doctor. I don't have that bedside manner that helps a doctor have person have a sensitivity to the other person's feelings.
Oh, thank you for sharing that.